Our expert panelists joining us today are Dr. Richard Palmquist, integrative veterinarian and owner of Centinela Animal Hospital. He's an author, lecturer, and teacher. Dr. Christina Chambreau, internationally known homeopathic veterinarian, lecturer, and teacher. Joan Ranquet, animal communicator, teacher, author, lecturer, and owner of Communication with All Life University. And Brendan Golia, professional pet trainer, behavior expert, and owner of OC Canine Coaching. Welcome to Smart Pet Talk. I'm your host, Anna DeVere. In this special episode, we're excited to be joined by Craig Foley. Craig is a medical industry entrepreneur, having spent the last 20 years involved in a variety of enterprises that involved diagnostic imaging and low-light therapy devices for humans and animals. Seeing the positive impact that low-light therapy was proving to have in many areas of physical challenges, and being an animal person, Craig transitioned from the human market to the pet market, as the need was clear and the available products were extremely limited. His goal was to provide a cost-effective home-use, low-light therapy device to complement proper veterinary care, and LumaSoothe was born. Welcome, Craig. What an honor and a privilege to have you joining us today. We hear a lot about light therapy for humans and animals today. Can you give us a quick overview of light therapy for animals? What is it and how does it work?
The animal world and the human world relative to light therapy are basically this one and the same. And light therapy, even though some folks even today think, well, what is this snake oil? How can light do anything? The reality of life is it's been a proven technology for, I'm guessing, at least 30 years. It really boils down to the fact that light in its what we call photobiomodulation, it's the light that penetrates the cells, and photons are actually reacting with the cells, causing an increase in microcirculation, complementary a reduction in inflammation, and in many cases it actually helps the cells to rejuvenate themselves. The human market's been doing this for some time. When we looked at it a while back, it's like, well, there's one or two minor little devices available for pets, but why not expand that scope to the animal world? And since then, we've had really good success with the concepts, getting a little bit of more understanding all the time. And a lot of that understanding comes from people who are using it for various different things for their pets, and they're seeing great results. And then they're communicating that to friends and their pet groups and whatnot. So it's progressing nicely on its own. There's not a lot of, huge public relations information being pushed out into the marketplace. It's mostly a word of mouth kind of situation. Light therapy is low level, so there's no real damage potential to the animal or to the human. So it's kind of like, it's a mirror. It's a little bit like the sun without any of the damaging effects of the sun. So it's been really an exciting process to be involved with. And I think we're just scratching the surface now of the many different kinds of things that we will be using light therapy for in the coming years.
So I want to ask, what is the difference between like your red light therapy that people can purchase in their homes and going to the veterinarian and getting the light therapy?
The product that is available at the veterinary offices is superior to any home use device. It's a laser as opposed to LED light. It, as Doc can attest to, it's tuned to the specific condition you're trying to treat. It's done in a very controlled environment, and clearly it is, in my opinion, better. Is it 100% better? No. Is it 50% better? I don't have an answer to that exactly.
But you're clearly something that.
But Craig, yeah, Craig, I would say as a veterinarian, that the two work together, and I actually encourage my clients to come in and get regular work if they're starting out with laser therapy, to get a unit, because I find that they respond much faster if the client's doing them with the low level therapy at home every day or twice a day than if we just laser them like once a week. And financially, you can't, if you can tell a person come in, every other day or 7 days a week for laser therapy to accelerate the process. But we're getting the same benefit from the low-level light therapy red light units that we're going to get from the laser. It just takes less application time for the laser to do the same thing. And so I'm really excited to have people like you entering the marketplace, because right now we've got a lot of clients who are like putting the baseball hat on their cat's head, instead of having a nice flat LED thing that they can just lay the dog on or lay the cat on. So I think as these products become more available and more sophisticated, what I find is that you guys don't even have to drive your market by promotion, because the word of mouth is so big that clients tell their friends, and whatever unit they get, it just sort of accelerates. They all start buying, units and going like, I do this now, and boy, it makes a huge difference. And I just tell people that light therapy is not magic. It's like nature's most elegant technology, and it's free. It's amazing.
What is the difference then? Like, I have a Rife machine that does sound waves. So what would be the difference between like sound waves and light therapy?
Boy, I'm going to let Doc answer that question. We have been using the light therapy. We're looking at adding potentially some pulsed electromagnetic field stuff to our products, but I'm not as familiar with the effects of the sound.
I do want you to talk about pulsed electromagnetic field therapy, though, because I think you have machines for both, right? Am I incorrect?
We do not have a machine yet. We are working on a process right now that will potentially provide both in one treatment pad, for example, either simultaneously or separately. But it's we're probably a ways away from that yet.
I'm curious about the difference in light. Let's get back to light. So there's red light, yellow light, blue light. Does each one treat a different disease? How does the person at home know what color they should be using with their animals? So two things. One is ill animals, and that's where they'd be going to the vet and being told what to do. But the other is, we love on this show talking about prevention and keeping animals healthy. So different color lights, what do those do? There's two treatment modules that we use in our equipment. One is for the arthritic dog, the spinal conditions, the deeper treatments, and that's how we really started our business. And we expanded to the skin related stuff, and ultimately combined the two. But the different wavelengths of light are, for example, blue. Blue is what we use. Blue's 470 nanometer, and it treats infections very nicely. Red light is kind of like the overall treat everything light. It's great for anti-inflammatory purposes. It helps with wound healing. It helps with hair regrowth. That's where that industry started. It's all in the 650 nanometer in the hair world. The differences, the green light and the yellow light we use. Yellow really is kind of a device that, a light that increases your body energy overall, which always helps the processes of healing. Green light is new in a way. Not many people know much about it. There's a whole lot of conjecture as to what it does, but one of the things that we're finding is it's also good for anti-inflammatory purposes. For the part of the issue with the deep treatment versus a shallow treatment for skin related stuff is your red light therapy and all of the other ones don't penetrate anywhere near far enough to get down into the joints where you have an arthritic situation. It's tough to get it down into the spinal area. So we use 940 nanometer infrared, and that penetrates 1 inch to 1.25 inches. So it gets into those areas. The light benefits all the cells, but the specific lights tend to be a little more effective with one situation or another. The way we've solved the multiple light issue is in our
deep treatment, we have both red and infrared and green. The infrared does 90% of the load lifting at depth. In our shallow treatment, we use everything but infrared. And the new diode chips that are out there these days, you can have a lot of different LED diodes in a very small area. And rather than try to have people say, look, if you're going to treat just an infection, do this. And if you're going to treat simply wound healing, do this. Or if you want to strictly regrow hair, do this. That's difficult for the home use device. So our skin treatment device, as we call it, the shallow treatment, has all of those in it. And it generally treats the whole spectrum. And on the deep treatment side, you get the deep treatment penetration with the 940, and with the 850, you get, it's deeper than the others, but it doesn't go all the way down. So it lends itself to home use very, very nicely. That we don't want to have the home user sitting in front of a book trying to figure out what to do, what color to use, how to do this, and a device that you can adjust for all those different things, because now your home use device becomes relatively expensive and the learning curve becomes difficult. And one of the problems we've always seen with home use is people will get frustrated and or tired of trying to figure things out. Rather, we just say, look, if it's a shallow treatment, a skin-related issue, a seborrhea, psoriasis kind of thing, or it's a wound healing, or you need, in a wound area to get the hair regrowing again, you just simply use the multiple colored head, and that's the end of it.
Unlock the secrets to your pet's wellness with Dr. William L. Schmidt's A Pet Owner's Guide to Animal Chiropractic. Learn to spot and address structural issues early during routine walks with your dog or horse warm-ups. This comprehensive guide provides step-by-step AVCA-certified chiropractic techniques to keep your pets healthy and active. Don't wait for small problems to become big ones. Grab your copy of A Pet Owner's Guide to Animal Chiropractic on Amazon or drwilliamlschmidt.com.
I have, this is something I've been thinking about for quite some time. I actually have 3 pets. They're all smaller dogs, but they're all 13 and over. They've all had spinal issues by jumping on and off the couch. I can tell they're sensitive in certain areas. How would this red light therapy benefit them right now? How could I incorporate them into their daily lives? And can you give me some more information on how that would help, like older pets or pets that are having probably some inflammatory issues?
That's a good question. There are a lot of folks that are in situations exactly like you're talking about. Specifically, we do a lot of sales to the dachshund people because of IVDD, and they absolutely love the device because they're treating the spine. And it's simply a matter of, in most cases, it's a matter of reducing inflammation, which means the light therapy used, as much as 2 or 3 times a day, if you're so inclined and have the time, is an ideal solution, because it's going to take that inflammation away. It's going to make the pet mobile more so than they are now. And in the long run, it may indeed help them, on a more permanent basis. But, with most of these kinds of things like spinal issues and arthritis, it's not like you're going to cure it and make it go away. You're just simply going to make them more comfortable over the long haul. And therefore, it's an issue of making sure you're compliant in doing it fairly regularly. We have some folks that have their dogs are in these athletic competitions where they're running and jumping, and they're finding that they use it both before and after the competition. So they're getting them sort of warmed up with the light therapy, and then afterwards, cooling them back down with it.
And I think it's almost a mistake to call it therapy when we're talking about at-home machines, because that implies that you need some training and competence, and you can't hurt a pet with low-level red light therapy. You just can't. You can overstimulate them if you're using like a pulse mode for too long in one spot. But in generally, basically, if it hurts, put the light on there, and then wherever it hurts next, put the light on there. It's because you're activating the acupuncture meridians, and the next place of stagnation will show up as pain. I have a bunch of personal stories on my own body, but Thursday night last week, I woke up with a screaming neck spasm. I have a distal cervical vertebrae that goes out sometimes, and I couldn't even move. I could hardly see, I could hardly walk. And I own multiple machines at my office and here. And the very first thing I did was stagger out into call my wife, who's an acupuncturist, and we just put the light on. In about 15 minutes, the pain was completely gone. Back to sleep and slept. No acupuncture needles, nothing. I would have waited 6 hours in an emergency room to be prescribed medication that might have worked in another 2 or 3 hours. So 8 hours later, before I would have gotten any relief from a pharmaceutical approach. And putting that light on there, I'm completely back to functioning in 15 to 30 minutes. So, and doing the light, the next spot would have. So she would treat that until it was better, and then treat that one until it's better. She probably treated 6 or 8 spots on my neck and back before I was completely recovered. But we can do the same thing with dogs. And I've seen dogs come in paralyzed and then treat a light unit and then get up and walk 15 or 20 minutes later. And the people in the parking lot sort of faint when the dog that was carried in on a stretcher walks back out. And that doesn't always happen, but it happens enough that you should be really advocating this stuff. And so we don't have studies about how you can use this preventatively at home, but I think if people would start using them, they would see benefit from it. That's my own personal opinion. And so they're so inexpensive that to have one and treat, especially dachshunds, and I think senior dogs also, if we treat the top of their head, that we may be able to slow down some of the dementia. I've seen dogs become more rational after they're treated with light therapy. Can't make the claim, but I've seen it happen.
Well, that's exactly the case. There's a lot of potential out there that is yet to be tapped in terms of studies and whatnot, but light has an immeasurable amount of benefits across the board. And the beauty, I think, of the home use device is, as you were mentioning, you can't hurt the animal. Unlike with a more powerful laser with a very focused beam, you can literally overtreat. In fact, this goes back to the hair laser days where they said you only treat every other day. You don't do it every day because you could have a reverse effect. With the light therapy, especially LEDs, which is what we use, it's a little bit like vitamin C. You can eat all of it you want, but your body's just going to get rid of what it doesn't need. It's much the same with the LED therapy. So the home use person is not going to worry about injuring themselves or the dog, and more specifically, not their eyes. Even though it's really annoying to look at, it's not going to damage the eye.
In fact, you can treat the eye. Yeah. In fact, you can treat the eye. Yeah. Yeah.
So this actually brings up a great point from a sustainability standpoint. If you had a machine at home, anytime your animal was showing any discomfort or a wound or pain or anything like that was mild, and you didn't yet need to go to the vet, this would, if you started treating right away with this, you might not have to go to the vet, might not have to get acupuncture, which uses needles and paper and all of that. So a one-time purchase of a machine would last a lifetime, right? You don't have to replace parts on it and things like that.
But the sustainability would also be because you're expanding. If you were continuing to go to the vet, you're expanding that treatment.
Right.
Right. I mean, clearly, I think your statement is very accurate. If you see something, deal with it right away. That doesn't preclude the possibility or the necessity to go see the vet ultimately and make sure it is what it is. But you might as well jump in sooner as opposed to later. And since you're not going to damage, you might as well do it.
And I have one caution on that. It's probably the only caution I have about light. In the research that we have, light therapy regarding cancer as a topic is complex, because phototherapy can actually kill cancer cells. It can also accelerate their growth based on increasing blood flow and so forth. So what I tell people is, since the majority of patients who have pain don't have cancer, if you do 1 or 2 treatments at home and your dog is getting better and better, that's good. But if the pain is persistent, it's really important to get a professional to evaluate that pain, get an x-ray. Because I have seen some dogs with shoulder lameness, particularly large breed dogs like Huskies or Rottweilers, that have osteosarcoma early lesions, and they have a foreleg lameness that's bothering the dog. And the light will actually alleviate the pain to some degree initially. And then those tumors can accelerate, and it's a bad disease. No matter when we diagnose this, it's bad news. But we don't want to have a client who feels like they accelerated the growth of the tumor by doing the light therapy. And I'd like to say here that I don't think that happens very often, but it is a precaution.
We get questions, I would say at least 2 or 3 times a month with that very question. My dog had some, cancer in its shoulder. Can I treat its hips? Well, yeah,
absolutely.
But if you're talking about treating cancer, or you're talking about treating an area that has had some malignancy, you go talk to your professional, your vet, before you do this. And that's the one caution that not only is in everything we talk about, but it's in our manual information as well. So, and as you said, there's some horizon that says may be some treatment for cancer with light therapy, but the wavelength, the power, that's a whole nother thing that we're just not prepared to go into with a home use device at this point in time.
Well, and you shouldn't, like if we're having general lay people use the machine, I think it needs to be safe, easily applied, inexpensive, which you're accomplishing all those things.
Craig, this is Anna, and I wanted to ask you, in your experience, what have you seen involving animals?
Animals react to light and medicine like humans. We've had people literally tell us that we turned the device on, we used it for 15 minutes on them today, and my dog was feeling better already. And by the next morning, the dog was up and around and running. We've had people call us and say, I've been doing this for 2 or 3 weeks, and I don't see much difference yet. People and animals react differently to all these things. Our general answer to these people is, look, just simply stick in there for a while. If you go down the road a month or 2 and nothing changes, call us up, we'll give you your money back. But give it time to work, because in some cases, we just literally had a nice lady call us and said that she had a magnificent response in less than a day. I said, well, that's great. It's not normal. It's usually 2 or 3 or 4 days before you start to see some improvement, but there are occasions where it's very, very quick.
All pets respond to soothing touch, but they can't always tell us how much it hurts. That's why treating them at home with LumaSoothe 2 is priceless. LumaSoothe 2 puts advanced light therapy in the palm of your hand. This safe, non-invasive treatment relieves arthritis, back pain, and general deep inflammation, along with skin injuries and regrowing hair. 2 simple modes provide comforting care that works naturally with your vet's advice. Visit LumaSoothe.com for the light therapy that feels like love.
I had a quick question in regards to red light therapy, and something that I do every morning is I go look at the sun as soon as I can to see that kind of that red spectrum of light, and I've been told it benefits mood and sleep, stuff like that. Is there any, do you recommend that? Is there at least to expose pets to that where they can actually see these lights for some time? I know a lot of pets don't get out regularly and they live inside a lot.
Yeah. I think clearly that the benefit you see from red light therapy for wound healing and all these things, there's a general wellness that goes along with it. And if you look in the human side of the marketplace now, there are companies building large, 2-foot by 6-foot panels of light therapy that people are supposed to go stand in front of. The beauty of the light therapy in that way is you're not getting the bad side of the stuff from the sun that you would get by being in the sun, but you're getting the benefit of it. We're looking at doing some larger pad type devices as well, so that you can do like a whole spine or a whole general area. And yeah, I mean, I don't think there's any reason that I see why you wouldn't want to do that, as just a good morning. How are you? Like your morning cup of coffee for your dog or your cat.
Right.
Just a quick tip on the spinal stuff, because usually when a dog has a spinal problem, if you look at them standing from the side, you'll see that their back's arched in an abnormal spot, and the giving them trouble is usually right in that location. So if for your first application you put it right on the arched spot there, and then come and treat behind the knees on both rear legs, from a Chinese medicine standpoint, you're opening the acupuncture point that opens the back. And so if you open up the back and then you treat that spot on the back, then you can treat just the base of the neck and behind the ears. And if you do that, you've actually opened up the whole back. And without doing a whole lot of other stuff, you stabilize the back pretty quickly with that very, very simple application technique. And since discs are so common, I think it's really great for people to have those lights. There's no problem with you treating the dog on the way to the veterinary clinic, or if it's at night, you don't go to the ER, then you can treat and then go to the veterinarian in the morning. Now, if the dog's paralyzed or can't feel its toes, you got to get to the vet right away. But a lot of times you can't do that. And there's a lot of issues. I have a client who has to drive literally 2 hours to find a vet who has a laser to treat her dog. And, I just told her, I said, please just buy one of these units and just put red light on the dog. You can see the vet, that's fine. But if you can only see the vet every 2 weeks and you have to drive 2 hours, you lose a lot of the benefit of the treatment rattling the dog around in the car. So I'm really excited to see companies like yours coming out.
So one of the most common complaints that I hear and have heard over the decades are ear problems in dogs and cats, both. So what sort of effectiveness do you see with a lot of the hot spots? That'd be another acute problem with skin. Speak to that.
The hot spot issue we've seen several times. We've had people comment that they get really good response with it. Ears, we have folks that have been doing some treatment of their pets' ears. They seem to be telling us that they're getting a fairly good response. My question is, the animal's ear canals are very, very, very deep, and where you place the light isn't probably very obvious to the user. I mean, you wouldn't just put it like on the outside. You want to put it kind of down, and I don't know how you get the right penetration in the right area, but we're very interested in that because we know for a fact that the blue light especially, and probably blue and red would be really nice for the ear infection. So I don't have a lot of experience with it yet. We have some people that are trying it and seem to say it seems to help. Whether, I think, Doc, you could probably comment more on because depending on how bad an infection is to start with, depends on, what you would go do first. Maybe the light therapy would just be a follow-up with some meds. I don't know.
The distinction between the outdoor lighting not being, in terms of general energy, is the one where you talked about the red light overall helping energy of all the cells. How are the photons really creating that healing energy, particularly with that red light general healing?
Each cell has photoreceptors in it, basically, and it just when the photon light hits it causes the cell to react, and it promotes just general circulation in the area. It reduces inflammation in the area, and it also it promotes the cell to start to heal itself. It's it kind of seems like smoke and mirrors, but it's basically just that reaction of the photoreceptors in the cells to the light hitting it, and the process that goes along with it.
And what's the range if you were treating, near the ear, or if there was other skin lesions? Like if you were treating near the ear, how much more of the head would be treated? What's like the span?
If you're treating the ear for, an ear infection.
But if there was also face problems, Jim, let's change that. If you were treating an animal that had hot spot or had itchy spots and hair loss in different spots on its body, you would need to treat each spot separately, or is there a spread of the effect?
No, the light diffuses outward some, and the head size is approximately 2 inches around. I don't know if you can see that very well.
We can. Yeah, that's good.
But yeah, basically you would treat each spot. So if you had a spot on the hip and a spot on the head, you would treat each spot individually.
Okay, excellent. And each spot, you'd treat them for about, I think you said 2 or 3 minutes?
No, well, yeah, it depends. The normal treatment time that we suggest is 15 minutes.
Oh, okay.
However, with some of the skin-related stuff, even if you do 4 or 5 minutes, you get a pretty good result. With the deeper treatment, you really need to get as much of that 15 minutes in as you can.
Craig, this has been amazing. How can our audience find your incredible product, LumaSoothe, and how can they contact you?
Well, our website, LumaSoothe.com, has all sorts of information in a lot more depth than we've talked about for people to learn. They can send us an email to customercare@lumasoothe.com, and we're happy to answer any questions they have. Call them if they'd like. The product is available both on our website. It's on Amazon.com. It's on Chewy.com. Farm Vet sells it. We have several vets offices that are now selling the product directly, so their clients can get it right directly after their first laser treatment. But it's becoming pretty readily available in most locations. And again, if someone is curious and they're in an area where some of this isn't as readily available, they can feel free to call us and we can ship directly to them within 2 or 3 days without any issue at all.
Perfect. Well, thank you so much for being here today. I think we all learned a lot. And I want to leave you with this thought. Universal compassion is the only guarantee of mortality. We'll see you again next time. Until then, love your pets. Medical information obtained from our website or the live show is not intended to be a substitute for professional care. If your pet has or you suspect they might have an illness or other medical condition, you should consult a healthcare provider. The opinions expressed on this TV program are not necessarily those of Smart Pet Talk, this TV show, or their sponsors. For all questions or info on sponsorship, email us at info@smartpettalk.com or visit our website at smartpettalk.com.